And we're like, hello, wonderful. Yes, we're live. Hello, everyone.
Hello, good morning.
Yeah, good morning, good afternoon, Mr. Ayo. You're welcome to our talk today. It's so exciting. I'm excited to see you today, and I'm sure we're going to have a great time having this discussion with our listeners. And
Okay.
of course, we all know that hair, like for a woman anyway, they say hair, the beauty of a woman, like, or the glory of a woman lies in her hair. That's from a
Correct.
Christian perspective, and I'm sure other listeners that are of other religions, so to speak, would share the same opinion. And that's why
Sure.
most of the time, anytime a lady needs to, one of the things that she ensures is on point before any outing is her hair. And
Of course.
it may contribute to the history behind the saying, let your hair down. So it's very
Yes.
exciting to have you
Yes.
here today. And I'm sure
Yeah.
we'll have a
Yeah.
very great time learning new things about the myths and the facts surrounding hair and hair loss.
Mhm.
So it's very good to have you here today. And once again,
Thank you very much. I'm
all
happy to be
right.
here.
So, I'll be asking some questions, and I'm sure these questions are some of which have plagued the minds of many. It has plagued my mind too as well, because sometimes I ask myself, how come I can't have hair? How come my hair is always falling? How come no matter what I do, we're in the generation of different hair fads. You hear people
Yeah.
talk
Yeah.
about rice water. What I know you must have heard
Hmm.
about that. Talk about, of course, nobody can try to use onions these days. Onions is gold. So onion therapy and all of that. So everybody wants to know how to maintain healthy hair. Everyone wants to know
Sure.
how to
Sure.
maintain luscious hair. And even the men too are concerned. I know some men already are beginning to have hair
Well,
extensions
yeah.
for
Why?
themselves.
Why should it be just women that's concerned about hair loss?
Of course, men too are very concerned about hair loss. So because I see people advertising different hair creams, especially for
Sure.
those
Sure.
suffering from baldness, whether hereditary or any other reason. So it's a very great topic to talk about these days. At least we can't be having COVID, NSAS, and then be battling with our hair again. No, we have to
Too much.
live
Too much to deal with.
much to deal with for 2020.
Yeah.
Okay, so the
Yeah.
first question I'll be having for you is, now, most people, when they notice their hair receding, the first fear they have is that, oh, I'm going to get bald. So is it that is this the eventual outcome of losing one's hair, or are there other scenarios that play out? Does any other are there any other outcomes from shedding one's hair? Because like I said, myself, I'm beginning to lose hair and my hairline is beginning to go some few inches backwards. So will I eventually get bald? I know women talk about this more than men do, because of course a man can easily go to the salon and have a clean shave, but not many women have
Hmm.
that yes to do that. So please tell
Sure.
us,
Sure. Like me.
can,
Yeah. Yeah.
can anything else happen if one begins to lose hair? Thank you.
Yes, thank you very much for that, Dr. Jiro. I mean, hair loss is a progressive condition. I mean, there are some where you have a sudden loss of hair, which I'll come to later. But most hair loss is a progressive condition. So the first thing you'll notice will be your hair fibers, will start thinning. Now, that thinning process is what we call the miniaturization of the follicles. The follicles are the roots of the hair. So when your hair starts thinning, that's the very first sign that you are about to start losing your hair. So you just don't wake up and all of a sudden you have got hair. it's a progressive condition. So the first thing is the thinning of hair, and the thinning of hair can last anything from a few months, to several years. So it's not inevitable that when you notice thinning hair that you would automatically go bald. But surely, there's that thinning hair is the first sign. And, the quicker you could come and talk to someone like ourselves, the quicker we could get you back to where you were before the thinning hair started.
All right, thank you. You don't have to forgive me and our viewers too. I lost my manners. So please, could you kindly introduce yourselves to us? I kind of know you, but I'm sure our viewers what's it do? And of course, generally, just tell us about yourself, sir.
Okay, so my name is Otubanjo. I'm one of the senior consultants in Vinci Hair Clinic. I'm also a senior partner. Well, no, I'm one of the partners in Vinci International. Vinci International, it's a medical aesthetic group. We have about 30 clinics in about 15 countries worldwide, from the Middle East, Dubai, right through to the US and South America, and even as far afield as Australia. So we are truly a global company. So I manage I manage the Africa region, which involves the 3 clinics that we currently have in Africa, which is in Lagos and Abuja and Accra. I have personally consulted with well over 2,000 clients on several types of hair loss. I have written several articles in newspapers, medical journals on hair loss. And I've spoken at several conferences like this, talking about hair loss. So I am passionate about hair loss. I mean, this is really something. I mean, for somebody that doesn't have hair, you think, but this is one of the things. This is one of the things about people that work in my profession, because some of my colleagues have experienced hair loss and they've done something about it. I've experienced hair loss, but I've done something different, to what other people have done. But I'll leave that till later. So that's me.
All right, thank you very much. Quite an interesting insight, and I like what you said when you said, as you can see, I've lost my hair. Of course, that makes it easy for you to, in a sense, put yourself in the shoe of your clients.
Absolutely, yeah.
Because I don't expect someone with a full Afro head telling someone that is experiencing early baldness, especially that, oh, don't worry. Of course, the person will be like, oh, it's easy for you to say because you have a fair. The man fits for the job, so to speak. Now, just talking about Vinci Hair Clinic, just out of curiosity, and I'm sure our viewers too would like to know. I can see the first eye in your logo is a man with extra arms and extra feet.
Oh, yes. That is the Vitruvian Man. The Vitruvian Man was a design created by Leonardo da Vinci, the Renaissance thinker and inventor. And basically what the Vitruvian Man is signifying is the proportionality of a human body. When the human body is in proportion, all from the head to the toe, then that is the sign of a full human being. So you might see the lines at the top of the forehead, which is where the hairline should be. Okay. And then one just there below the nose, and then one on the chin, and then on the chest. And every human being should have that line proportionally relative to the height or the shape of their face.
Oh, okay, so I just that out. This is Africa. And then we may have some very religious viewers. They say, this man is having an eye.
I know. I've had people in Ghana actually saying, oh, there's something satanic about that sign. I said, no, there's something satanic.
I just needed, I'm familiar with that logo, so I just needed you to point it out for our viewers so that they know that even though they have your baldness to worry about, they don't have that sign to worry about.
It's a well-used sign in medicine. Yeah.
Okay. All right. Thank you very much, Mr. Ayo. Now, talking about baldness, like you said, it's known to affect men more. You know, as a doctor, I know that one of the requirements, so to speak, for baldness is testosterone. That's why some persons that have liver diseases, because they cannot synthesize testosterone, in a sense, they begin to have hair where they're not supposed to have hair. So,
Yeah.
so speaking of the men now, they begin to have the pattern of their hair distribution kind of changes. So, tell me, is it just men that suffer baldness? Is it gender? Is it restricted to the male gender, or can females too suffer baldness?
Yeah, right. Okay. Hair loss affects both sexes. Let's start from there. Now, there are different types of hair loss. Some are more particularly prevalent in the female population, while some are prevalent in the male population. In actual fact, I mean, if you think about it, you know, there are effectively three different very main categories of hair loss, or alopecia as we call it. The one is the genetic form of hair loss, which you are alluding to in terms of the testosterone. Now, for the genetic form of hair loss, what causes that is a particular enzyme, which we call dihydrotestosterone. It's a byproduct of testosterone. And that is what actually weakens the follicles on our scalp, because the follicles are the roots of the hair. So what dihydrotestosterone does, it reduces those follicles in size over a period of time. And as they reduce in size, that's when you start noticing your hair thinning. So that is the genetic form of hair loss. And that affects roughly about 60% of men, and probably around about 40% of women would experience that particular type of alopecia, sometimes up to menopause. Those are what the data reveal. Now, there is another type of hair loss that we call traction alopecia. Now, traction alopecia mainly it affects women because of some of the styling practices that they do when they go to the salon. Very rarely would you see a man with traction alopecia. You know, it's not that it's not possible, but it's really very rare. You know, so traction alopecia tends to affect women a lot more. In fact, prevalently more. Now, there is another type of alopecia that are caused by medical conditions, or sorry, what I call underlying medical conditions. So alopecia areata, which is the sudden loss of hair. So you go to bed one night and then you wake up the next morning and you see this small patch of hair loss on your scalp, and then a couple of days later there's another patch somewhere else, and then it goes like that. Yeah, and people get really freaked out about it, you know, and you know, I've had people say, "Oh, it's a spiritual thing," and I said, "No, no, no." I said, "No, it's not a spiritual thing. It's not a spiritual thing. It's simply there's a medical condition, and I think lupus is one of those conditions that actually triggers this particular type of loss of hair. And it could go as far as the total loss of hair on the scalp, which we call alopecia totalis, or even the total loss of hair all over the body, eyebrows, you know, pubic hair, and you know, everything just gone, which is alopecia universalis. So the cause of that particular type of alopecia is an underlying medical condition. So those are the three main categories of hair loss.
Okay. So I will just, before I take the next question, I will just follow up to what you just mentioned when you were talking about the different kinds of hair losses. So now sometimes I haven't had a slight background in pathology. I know that skin pathologists, dermatopathologists tend to get confused, so to speak, when they have a punch biopsy of a hair sample to deal with, because there are a myriad of causes of alopecia, pathologically speaking. So are there any skin diseases that someone may have, especially the common type that women suffer, dandruff? Can it lead to hair loss?
No, dandruff doesn't lead to hair loss. I mean, if you actually think what dandruff is, it's basically the drying up of dead cells on the scalp. Yeah. So, and what you're doing when it comes out is basically falling off. So no different from any dry skin, you know, falling off when you rub it or shake it. It doesn't necessarily translate into hair loss. However, there might be something going on with your hair, which you need to look at. So dandruff in itself doesn't cause the hair loss, but it might be something else going on that you need to look at, just to be safe, so you don't lose your hair.
So just are some people more prone to having dandruff? Because you said it's shedding of skin, but no matter what they do, they just have those flakes falling off. They are combing, their shoulders are dirty, their hair, they just have sometimes chunks of flakes falling off their scalp. Are some people more prone to having dandruff than others?
Yeah, well, I mean, it's a fungal issue, and that's why there are so many medicated shampoos out there now to deal with that fungal issue. But the basic point in relation to hair loss, it doesn't directly translate to hair loss, although there might be underlying things that might lead to hair loss that you need to look at. Yeah.
All right. Then traction and alopecia. Just as you said, as a result of what we do, the main culprit for that is what we call Ghana weaving or Senegalese braid. Is there any point at which there's irreversible damage to the hair roots or the hair follicles, such that traction alopecia becomes irreversible, especially when such hairstyles are done on children?
Well, I would personally, I wouldn't do tight braiding on children. I just wouldn't do it. I mean, I think the scalp is really not quite, there yet. I mean, it depends on the age of the child. I mean, I've seen young kids of, 7, 8, with braids. But anyway, the point about braid, I mean, people accuse me of being a killjoy. I'm not a killjoy. I love to look beautiful. I love women to look beautiful. And, you go into the salon and you do everything to come out looking $1 million. Perfect, no problem. The issue with braiding, and this is what I have against braiding, when you do repetitive tight braiding, back to back, so you do one tight braiding, and 3 weeks later, you take it off, you do another one, and you keep doing that. Over a period of time, what you find is those follicles, especially in the frontal part of the scalp, starts getting weaker and weaker and weaker. And that's where your hairline starts receding back. Okay, and you get that Sisi Eko, Mama Eko syndrome. Yeah. Now, there is nothing wrong with braiding, but why does it have to be repetitive? So why don't you just do braiding? And it doesn't have to be so tight that you're excruciating pain.
Yeah.
Wait, 3 weeks later or 4 weeks later, take it off. But don't do another one for maybe another 4 weeks to allow those follicles to recover.
Yeah.
So, and that's something that people don't do. So you go to the salon, they say, well, I love braiding, so that's what I'll do every time I go to the salon. Well, the damage could be a few years down the line.
Okay, so that's the irreversible damage to hair follicles.
Well, it depends on when somebody comes in for a consultation with us, for instance. So if the hair is still thinning, and they haven't quite on board, but they could feel that the hair that used to be that long is now this long and it's thinning, then it's reversible, through some therapies that we deploy in the clinic, like mesotherapy or platelet-rich plasma therapy, or just topical medication like minoxidil. So it's reversible. Now, if it gets to the point where you've actually gone bald, the hair, their frontal bit is gone totally, then the only way we're going to be able to restore the hair is by having a transplant. Yeah.
All right. Now, my next question is this. I know you've heard the saying, you are what you eat. All right.
Yes.
Against just trying to buttress the fact that nurture also tends to boost nature. So, are there any diets or maybe, yes, diets mainly that improve the texture, the quality of hair?
Yeah, I mean, diet does play a role in good hair growth.
Okay.
A diet doesn't lead to baldness. Let's just get that clear. It doesn't lead to baldness. But if you've experienced good hair growth in the past, and then say a few years down the line, you're not getting the same kind of hair growth, then, naturally there's something going on with your diet. Maybe you've had a change in diet, which is causing the hair not to grow as much as it used to. Now, there are supplements, loads of supplements out there. I mean, I know lots of Nigerian women swear by biotin. Yeah, biotin is all well and good, but biotin is not the only nutrients, that you need. I mean, there's a whole, I mean, I've got one of our supplements. You got vitamin A, vitamin C, vitamin E, folic acid, biotin, calcium, zinc. Got so many, so many elements that needs to be within the body, really, for you to get hair growth. Now, the food you eat, I mean, you might have the perfect diet, the perfect nutrition, but if it's not been absorbed in the right quantities in the bloodstream, it's not helping in terms of the hair growth. So, that's what the supplement is. The supplement is not to replace, it's to supplement whatever you're eating. Yeah.
So now talking about if your body is not absorbing, that sort of jumped at me. Being a doctor, I know that there are certain medical conditions that can affect the quality and the quantity and even the rate of acceleration of hair growth. Now, could you just tell our viewers what kind of conditions an individual may have that could affect the quality of their hair?
What conditions? Are you talking medical conditions or?
Common medical conditions, especially.
Common medical conditions. I mean, I know there's a myth, there's lack of information about what, loss of hair due to chemotherapy treatment does. But, chemotherapy, I mean, you will be well familiar with this. Chemotherapy doesn't involve permanent hair loss.
Exactly.
It's just a side effect of the treatment that you're going through. And once that treatment ends, you regain normal,
Yes.
I mean, the conditions that can affect hair growth. I can't think of one, at the top of my head, except that, I mean, if you're eating good and a balanced diet, and and like I said, nutrients, that all the nutrients you need are being taken into the bloodstream, there's absolutely no reason why you should not experience a good hair growth. I mean, some people say, look, genetics comes in because some people have long hair, and some people, no matter what they do, it cannot grow beyond their shoulders,
Sure, that's true.
Precisely. So how do you account for that? I mean, there is so much we still don't know about some of the things in the hair loss industry, only because not enough money has been devoted to the research to enable us to gain more insights and more knowledge. So, some people have long hair, some people have short hair. It doesn't necessarily mean that you're not eating well. It doesn't, it's just one of those things,
Now, I'm going to take you slightly back. Like I said, in the last, from say 2013 till date, natural hair has become the fad for women. As a matter of fact, if you use relaxer on your hair, you are considered, in a sense, less of a human being, kind of.
Wow.
You are considered less, somehow less. As a matter of fact, some social media groups that started to sort of popularize the fads began to demonize the use of relaxer. I'm like, come on, it's just hair. It's nothing more than hair. So I was once part of those who took part in it. And I noticed that no matter what I did, I used what we call dogoyaro in this part of the country, in my part of the country at the time. I used honey, I used onions, but the hair just won't grow. So the question is, or rather my conviction then was that hair is a question of what we are given by genetics. Because some people don't have to do anything before their hair grows and it grows to luscious lengths and it's just absolutely beautiful. But on the other hand, some other people, no matter how much they spend on products, no matter how much natural therapy they carry out, the hair just grows. And you already kind of answered that question when you said some people have hair up to their waists naturally, as other people ear length hair. But just quickly, just tell us briefly and maybe convince our viewers, especially because some people have that anxiety that I'm doing so much that I'm not seeing results. Is there something wrong with me? So, and like you said in the beginning of this talk, hair loss, or in a sense, lack of hair growth, as a matter of fact, has been a cause of anxiety for a number of people.
Oh, yes. Yeah.
Allay that fear and put to death that notion or that myth that you must have long hair. So please, just quickly.
Yeah, I mean, you touched on several very good points here. I mean, just let me pick up on the point about the hair relaxer. I mean, I personally have no problem, no issue with hair relaxers. The reason why Africans or people of African origin have had to use relaxers is simply because managing our hair, in its natural state is very difficult, very, very difficult. And we've been using hot combs. Do you remember the hot combs in the past? Yeah. And, in the 70s and the 80s, the relaxer came in and made life a lot easier for us, Now, the problem is it's gone a bit too far because there are so many dangerous products out there which are not really conducive to the human skin. And when they are applied to the scalp, can cause horrendous damage. And I've seen some really horrendous damage caused by some hair relaxers, to the extent that I've turned around to the woman, I'm saying, I'm so sorry, there's really nothing we can do. I mean, and that is really saying a lot when you come to a hair loss clinic and the consultant is telling you that I'm very sorry, but there isn't anything we could do for you. It just goes to show you the corrosive and the damaging effects of some of these relaxers. So I would caution people to be very careful when they go into the salon, what products are actually used on their scalp. It doesn't take much for you to ask the attendant or the salon worker to show you what products being used on your scalp, and for you to have a quick read and see whether it's actually been approved by a regulatory body like the FDA in the US or NAFDAC in Nigeria, because they would have gone and tested that product to make sure that it is good and safe to use on a human skin. We see a lot of things. I mean, for instance, not just relaxers, but glue that people use in fixing hair, Yeah, I mean, that again, some of those glues are not meant for the human skin. Yes, they'll use it and they'll fix the hair and you'll come out of the salon looking like a Miss World. But then sadly, 6 months to 12 months down the line, you're having some serious or horrendous loss of hair and you don't know what's happened. So people need to be very, very careful about what is used on the scalp and making sure that the salon workers actually read the instructions and apply the instructions to the letter.
Yes, talking about it, as a matter of fact, relaxer labels usually have a clause asking you to do a spot test on just an inobvious patch of your hair.
Precisely.
How people have their hair dropped into the washing sink while in the salon. So that's difficult and it can be that horrible sometimes. So it's very important when you're in the salon. That's this for our viewers. I'm just trying to buttress the point you just made. Do a spot test. Don't be in a hurry. This is your hair, and I've seen people have scarring from relaxers.
Oh yes.
I know you can tell us better. Once the scalp is scarred, hair cannot grow over that.
You're absolutely right.
The permanent.
You're absolutely right.
I'm just going to take a few more questions, and then now what I need to know from you is, now I've been having my hair grow so beautifully, and all of a sudden it happened to me. So this is like a personal experience now. My hair just stopped growing. I cut it twice, hoping to regenerate the hair. And this is just not growing. So is it possible for someone to have their hair stop growing after experiencing amazing growth for some time? Yes.
And by the way, it's a myth that when you cut your hair, the hair grows back better. Nah, no, it doesn't. Now, I mean, have you changed your diet lately, or have you been ill lately, or so those are the kind of questions I would typically ask, if somebody comes in to complain that they're not getting the right kind of hair growth. But you know what? Like I said earlier about diets, you might have the best diet in the world, very balanced diet. You eat all your vegetables and everything else. But for whatever reason, it's not been absorbed in the right quantities in the bloodstream. So, a supplement might be all you need. And please, not just biotin, not just biotin. Biotin I've just read out a lot of the elements here. The nutrients. Vitamin A, C, E, B. Folic acid, calcium, zinc, so many, so you need to get balance of all those nutrients, really. Yeah.
Yes, since we're talking about chemicals, before I go to the next question, dyed hair,
Yeah.
dyes seem to be the fad these days. I've seen all sorts of colors. So, and there was a recent advisory from the College of Oncology, especially with respect to uterine and ovarian cancers.
Okay.
Yes, and their relationship with, or the relationship with hair dyes, permanent hair dyes, and these two groups of cancers. So is it something that has been confirmed? I tried to check the individual colleges of oncology, and I've not seen the direct advisory go from there. But is it something that the body of your specialists have been able to confirm so that we can advise our listeners? And then, is there any permanent damage to the hair follicles that can result from the use of hair dyes?
Yes. I mean, I'm not an oncologist, so I can't link the use of hair dye to cancer or whatever. But I've read several articles, in medical journals, linking some of these chemicals to cancerous, create cancerous cells. But what we tend to find in the clinic is the immediate visual damage that's the dye causes. I've had people that have come in and they've used dye, a particular type of dye, and then 6 months later, they've had a scarring alopecia, which you mentioned earlier. Which basically is a very, very difficult condition to treat, even for us, because even a normal transplant, which you would offer to someone who's bald, it's not really that guaranteed for somebody with scarring alopecia because of the nature of the skin, skin tissue, it won't take the grafts. So yes, dye can cause that kind of scarring alopecia. So it's yet again, I'll go back to what I said earlier. Be very careful to read what's about to be applied on your scalp before it's applied.
All right. So, like you said, if it's as a result of hereditary conditions, or if someone is predisposed to being bald by virtue of family history or family tendencies, there's hardly anything he or she can do about it. But is there anything that can be done to prevent the rate of recession of the hairline? My hairline is beginning to recede. Oh no, I'm not yet 40. Please don't go anywhere. My hairline, please have mercy on me. Is there anything I can do to slow this rate of recession of my hairline?
Well, let me actually correct something. I mean, even with androgenic alopecia, which is the genetic form of hair loss, you can actually prevent it. That's number one. You can prevent it, yes. The key thing is being able to identify the signs at a very early stage when you start seeing it. Now, for men and indeed women that suffer from androgenic alopecia, the first thing you will notice is the hair in the affected part, and it's usually in this part of the scalp. They start getting soft like baby's hair. So if you never relaxed your hair, say your hair is in its natural state, all of a sudden you start feeling that the texture of the hair in that part of the scalp is soft like baby's hair. That is the miniaturization process starting. Now, if you come to us at that point to say something is not quite right, we can actually prescribe medication and some therapies to really get you back to where you were before. So you can prevent baldness. The sad thing is a lot of people don't pick up on the signs and then they go bald, and that, by that stage, they need a lot more invasive treatment.
All right, viewers, specialist. I don't want to use that very common term. So you've heard from the specialist. balding is something you can do something about, but the key point here is pick it early and then come quickly to Vinci Hair Clinic. Correct. And you get sorted out lickety split.
Absolutely.
So now for our viewers, please don't forget to drop your questions in the chat box and we'll take them at the end of this presentation. Now, sir, I just want you to tell us what are the available hair loss treatment options. I know it just can't be biotin, just because I hope you're listening to that. Don't go popping biotin pills or rubbing biotin pills in your capsules in your hair. So there has to be other options. There have to be other options for hair loss treatment. So please, could you quickly take us through that?
Yes, I'm sorry. Were you asking me a question or?
No, the hair loss, like you said repeatedly, it's not all about biotin use. So
no, precisely. Yeah, precisely. I mean, there are several elements that goes into a good hair growth. So I've mentioned vitamins A, E, C. I've mentioned zinc. I've mentioned folic acid. You know, so many different types. I mean, sorry, I'm going to have to do a plug. We have our own supplement, which is, you know, has all the supplemental facts at the side, and it tells you everything in the right quantity that you need to have. And just taking one capsule a day, you know, for about 30 days is really, you know, sorry, for about 90 days is really all you need, you know, to really get you back to where you were previously. So that's why I was saying that biotin, you know, just taking biotin pills is not the only thing, you know, that you need. You need a lot more than that.
Okay. All right. Thank you very much. Now, the more invasive aspect of treatment of hair loss. I know in other societies, people with long hair enough to share kind of donate their hair in advance, especially for children that have suffered alopecia from chemotherapy and they just need to have their hair back. So those ones are donated for making real wigs, not for transplant. So please, can you tell us about the stage of hair loss that will require transplant and how common it is in this environment? Is it something that is easily affordable by those who really want to have don't want to have the burden of hair extensions, you know? So please take us through hair transplant.
Well, yeah, I mean, as I explained earlier, once you go bald, basically what that means is the follicles have died. So because when follicles die, they can't produce the hair fibers on your scalp. Now that is the point where you will need a transplant. And what is a transplant? A transplant is really microsurgery, and it involves taking donor follicles, usually from the back of the scalp, to place it in the areas where we need to place it. Now, on average, a typical human being has between 100,000 and 150,000 hairs on the scalp. Now, by doing a little excision, like cutting out a bit of skin tissue, usually from the back, you could have anything up to 5, 6, 7,000 hairs or follicles, which you could then harvest and then implant in the areas where you want hair to start growing. So it is a treatment for people who are gone totally bald, and they want to restore hair where they've gone bald, and that really is the only solution that we will be able to offer them.
Okay. Now, there's curiosity and see. Some persons, in my experience, and I stand corrected, some persons that are bald on the scalp are very hairy on the other parts of their skin. My cousin, for example, has practically no hair on his scalp, but he literally can comb the hair on the other parts of the so, but if such an individual were to have a transplant, because you just mentioned the back around the nape of the neck or the nuchal area of the head, that's where transplants are gotten from. So is it possible to get transplants from this area of the skin? Okay, I don't have hair on my head, I need it there, and I'm having excess on my skin. So can you, the specialist, decide to take follicles from that any other area of the skin apart from the scalp for a hair transplant?
Okay, it's a very good question. There are two types of hair. One is terminal, and the other one is vellux. What we have on our scalp is a terminal hair, and that can grow as long as your waist. If you're lucky enough, if you're lucky enough, yeah. Now, vellux hair does.
I think I'm losing you. Can you hear me? Mr. Ayo, are you there? Oh, this one. Okay, I think we've lost our presenter. And okay, we're trying to get connection back and it will be back on shortly. So I'll quickly take the question that we have in the chat box before Mr. Ayo comes back. Okay, Mr. Ayo, are you there?
I'm here. I never went. I can hear you.
You were kind of frozen. I was wondering what was
Oh,
going on.
right. No, no, I'm here. So I was, yeah, so sorry. So I was explaining the difference between the terminal hair that we have on our scalp and Velox hair, which we have other parts of our body. So the Velox hair doesn't grow beyond a couple of inches, no matter how hairy you are. Whereas terminal hair that we have on our scalp can grow as far down as your waist. Now, when we're doing eyebrow transplant, we normally take the donor follicles from the body because it doesn't grow beyond, the Velox hair is ideal when you're doing the eyebrows transplant. So that's what we take from the body. But if you take the Velox hair and implant it on your scalp, you're not going to be happy because it won't grow. It won't grow. Yeah. So
No,
yeah.
makes a lot of sense. Okay, so quickly, since we're talking about hair and then Venex hair and terminal hair, this just for some of us, it's a medical condition. Okay, everyone, sorry about that technical disruption and the break in transmission. So we'll continue from where we lost connection pending when Mr. Ayo returns. Okay, all right, wait, just before the break in transmission, I was trying to ask Mr. Ayo of the African or Negro race. So it's more a Caucasian problem, so to speak. So it's, of course, a condition where hair grows on areas where hair is not supposed to grow, and it grows to excessive length. So quickly looking at these questions on our chat box before Mr. Ayo comes back in. So I've got brown hair and it looks kind of dusty, especially when it's full. Please, is there a way to make it look neater and a bit more glossy? Yeah. And we're expecting him. So I just want to, while we're having this breaking transmission, I'll just encourage everyone to please send in your questions, your comments, and even contributions are welcome, and we'll have them answered. We'll have your concerns addressed when Mr. Ayo gets back in, which will be anytime soon. So I'll see you all shortly, and please don't go away. Stay tuned, and we'll be with you shortly. Hi, Deji, are you here? Okay, we're back live. So sorry about the breaking transmission.
Yeah.
For waiting.
Yes, I think there might have been a network issue here. Can you hear me now? Hello, can you hear me?
Yes, I can hear you clearly now.
Okay, all right. I'm so sorry about that. It's a connection issue. Yeah.
Yes, so technical hitch. So I was asking about the werewolf syndrome, what it is, how true it is, because it sounds like a myth to most people, and then just tell us about it.
The syndrome was, sorry, I didn't quite catch your question. I think that's where we got off.
Yes, so the werewolf, I've seen instances where people have hair on their faces, making them look like the legendary werewolf.
Yes, yeah.
So, is it a myth or is it actually a fact? Because I've not seen it in anyone of African descent. It's more among white people, Caucasian. So is it something that is actually real? People would like to know.
Yes, it's an hyperhirsute, when you have excessive hair, especially when you don't, Now, the latest case I remember coming across was in Spain, and there was a very innocent explanation about that. Apparently, what these kids were doing is they were playing with minoxidil. And then they were not washing their hands properly, and they were rubbing on their faces and the like. Now, minoxidil is a topical medication that we use for hair growth, and it's a very powerful very powerful topical medication. In fact, we always advise people that once they've applied it using their fingers, they must wash their hands thoroughly before they put their hand on their face or any part of their body. That's how powerful the medication is. So that's what happened with this case. And we, they said, look, this is what happened. It was a very simple explanation, and there is no werewolf syndrome, So yes. Yeah.
Secondly, before I go along, I just want to tell our viewers, Mr. Ayo is not encouraging you to self-medicate. On no account should you go looking for, I'm not going to say the name again so that you have long hair.
Please don't.
Not fuller beards. It's not for you to have fuller beards. And the fact that werewolf syndrome has not been reported in Africa, you just might be the first. And dermatologists will be very happy to have you as a case. So please do not self-medicate on any account, because you have to know what medical history is. You have to know what your allergy history is before you use any medication. And that's why Mr. Ayo and Vinci Hair Clinic is there for you. They evaluate you, they know your histories and possible allergies before prescribing medications to you. Because if you do that by yourself, for yourself, you will be on yourself. You'll be on your own.
Yes. No, you're right. It's never a good idea to self-medicate. Yeah.
On any account, you may say, after all, it's just hair. Trust me, it's not just hair.
It's not just hair.
Okay. Yeah. Now, I know part of this, the purpose of this show is to bust myths, So another thing, I know it's going to be funny, but I just want you to quickly talk about it. They say women will have hair on their faces. Please bust that myth for our viewers. Once and for all, put an end to it.
That is the condition they call polycystic ovarian syndrome.
Yeah.
It's just an excessive level of testosterone, and unfortunately there really isn't a cure for it. And like I said, the only solution obviously is to either use laser hair removal or use twizzlers, and what have you. But it affects a very, very small minority of women. Yeah.
Okay, thank you. My last question, the very last. We talked about hair transplant being the last and final option most of the time for treating hair loss. Now, it sounds like an expensive procedure. Now, my first question is it possible, of course, just like any other form of transplant, it can be autologous, you giving to yourself, especially skin grafts. You can have a graft from one part of the body to another part of the body. But sometimes, are there extreme situations where the hair transplant has to come from someone else? So is that also a possibility? And if I can't afford a hair transplant, what other options do I have? And then, is it very affordable to have a hair transplant?
Okay. Wow, there's so many questions there. So let me let me start from the beginning. Medically, it's possible to have a third party donate follicles for you to have implanted in your scalp. Medically possible. Unfortunately, it's unethical.
Oh, I see.
For a very simple reason. Whilst medically you could take the follicles from the donor and surgically implant it and it will grow, but because of all the DNAs and the cells and all that, you would have to be on anti-rejection drugs, virtually all your life, or else those follicles will die off, And quite frankly, to be on that kind of medication for the rest of your life, only for vanity, it's not worth it. So I don't think any surgeon worth his salt would ever do a third-party head transplant. Now, in terms of the cost, well, a lot of the things we use in the clinics in Nigeria and in Ghana are imported from the US or the UK, and they do cost money. So as much as we would like to offer this treatment to everybody, because hair loss is a deeply, deeply psychological issue for lots of people. Yeah. And as much as we like to try and help as many people as possible, with their hair loss issues, unfortunately, there's there's a bottom that we can't go below, you know. But you know, we always say to people, look, come to us, come for a free consultation, cost you nothing. At least let's look at you and then let's try and see if there are alternatives which are a lot cheaper that we could do for you. So transplant might not be or might be too expensive for you, but perhaps a scalp pigmentation, for instance, you know, which is a cosmetic form of treatment, might just give you that self-confidence, you know, and provide and restore your self-esteem. So hair transplant is not the only solution. It is the ideal solution because obviously we all want hair on our scalp, you know. But if it's beyond your affordability, there are other things we could try. So come to us, get a free consultation, and let's take it from there.
Okay, that's very encouraging to hear. It brings a lot of comfort. So viewers, you've heard the expert himself say it. You can come for a free consultation. The fact that you're losing your hair doesn't mean you need a transplant immediately. So he's here for you. And again, I know we love the word free, a free consultation. So I'm emphasizing that's one word I'll gladly repeat. And then I also want to let everyone know, you heard the expert say again, the fact that you have a lot of hair doesn't make you a donor. So don't go tell anybody I can donate hair for you for a hair transplant. I know that thinks you need a hair transplant, you can't receive hair from a third party. It's not advised. And like you heard Mr. Ayo say, no surgeon worth his salt will advise a third party hair transplantation from anyone. So that's the last question we have. The last question we have for Mr. Ayo, then we'll go right to the question and answer session. I wanted to try answering the question, but I saw the first one and I lost heart. I said, wait, let the experts come back. While you were away, I saw the question and I read it and I said, this is not my area and I can't answer it. Okay. I'm glad that technical is over and we'll quickly take the questions, and Mr. Ayo is ever ready and able to handle every one of them. So the first question here for Mr. Ayo is, okay, I'm going to start from the top to the bottom. I'm going to start from the first question and then take it down. Okay, so good afternoon, everyone. I have suffered hair loss and baldness in the edges aspect for 30 years plus. I think it is somewhat genetic. However, when I'm pregnant, I realized that my hair became very full, healthy and long, then reversed back after. What would you suggest is the cause and what can be done to prevent the continuous hair falling and baldness?
That's a very common question we get asked in the clinic. When a woman, I'm sure you will agree with me, when a woman is pregnant, the estrogen level during pregnancy is a lot higher than normal. And one of the good side effects of that is the abundance of hair, you know, during pregnancy. You know, we call it telogelate effluvium. You know, it's just the hair is really massive. You know, you get bouncy hair. That's why women look so beautiful when they're pregnant. You know, now unfortunately, as soon as they've given birth and the estrogen level goes down to normal, the hair they gained during pregnancy is lost. They never had it. It was just something, you know, that they gained during pregnancy. So now they're losing it. So it's not hair loss as such, you know. It's simply you're going back to where you were before you became pregnant. But then, having said that, there might be other issues going on. So don't let me rule out any other type of hair loss, maybe genetic form of hair loss, or traction or medical induced hair loss. But generally speaking, that's what happens with pregnant women before they give birth and after they give birth.
After they give birth. Now, somebody is asking, I need help with dandruff. Please, I'm going to eradicate it very quickly. We're not going to advertise any particular brand here, but Mr. Ayo mentioned it clearly that it's as a result of a fungal infection. That's why we have many antifungal shampoos on the shelf. So, yeah. So either visit when you buy one and it doesn't work, you may need to have another review by a specialist. So Dr. Vinci Hair Clinic is here for you. So get a good anti-dandruff hair shampoo off the shelf, and I'm sure you'll be good to go. Now, the next question is, what is the major cause of hair loss in men, particularly when the hair has built up only for it to start breaking?
Sorry, talking about men now.
Yes, men.
Men. I mean, most most men suffer from androgenic alopecia. I mean, that is predominantly the main cause of hair loss in men. It's androgenic alopecia, and it's the genetic form of hair loss. So when you have, male or sometimes female members of your family who have been losing hair, there is a possibility, it's not certain, but there is the possibility that you might suffer from that same hair loss. Which is why I said earlier that once you start feeling that the texture of your hair in that area is like baby's hair, then you need to start doing something about it.
Okay. Yes, the last sort of answers the next question. I noticed the texture in my middle hair is now softer than the rest. Does that precede baldness? You've heard the answer already.
Absolutely.
What can say this? If yes, it does precede baldness, because Mr. Ayo said it in the course of the discussion, and he just mentioned it again, that once you begin to notice thinning around, especially the middle of your hair, it's a prelude. It's a having of baldness, and something can be done. So you see, come to Vinci Hair Clinic. Or Mr. Ayo, do you want to add anything to that?
Yeah, I mean, they're basically two medications that we normally prescribe at that early stage of thinning hair. For men, it's finasteride, which is a DHT blocker. Remember what I said about DHT, dihydrotestosterone, being the cause of the pattern baldness. So finasteride blocks the effects of DHT. The other medication that's normally used in combination with finasteride is minoxidil, which is a topical medication, really to give extra strength to the existing follicles to make them stronger. So you usually, when you use those two medications jointly, you could go back to where you were before the issue started. And we've had many, many clients who have been absolutely amazed at how they've stopped the baldness even before it started.
All right, once again, please do not self-medicate.
No.
See a specialist before you use any prescription on your skin.
Especially with finasteride. Especially with finasteride. I mean, you can't buy it on the over the counter anyway. You can't buy it over the counter. So yeah.
You can get it over the counter. That's my comfort, because when you said finasteride, I was like, wait, prostate cancer, BPH, that was what came to my mind. So you can't get it over the counter. That's some comfort for me. Okay, so I noticed that anytime I cut my hair, I see some whitish flake on my scalp. What is the cause of that?
White flakes?
Yes, on my scalp.
Could it be dandruff? It could be dandruff. It could be dry skin. So I'm just trying to, come up with the possible reasons why you would have that. So dry skin, dandruff. I can't think of any other reason that would produce white flakes on your pillow.
Yeah, I've noticed that. Sometimes some men do not pay attention to their scalp. They don't cream their scalp. They just cream their body and they go on their merry way. So at the time of having haircut, especially those who have very low cuts like yours, they notice that the skin is very dry. Of course, the skin of the scalp is just like the skin of your body. If you don't oil it, just imagine that you have a naturally dry skin. It will reflect on your scalp as well. So that will be largely as a result of dryness, especially if it doesn't flake like dandruff would typically do. So it's likely. So just oiling with olive oil.
Just moisturizer. That's all you got.
Good to go. Now, one man's meat or one man's treasure, another man's trash, brings me to the next question. Can I have a product to permanently remove all the hair on my head?
Well, that's a different specialist area. I don't want to know about removing hair. My business is to restore. So I don't,
I wasn't expecting this this question at all? Can I have a question?
I'm sorry, I'm being facetious here. I'm being facetious and flippant. Actually, I mean, there are hair removal clinics, using laser and other forms of hair removal, but that's not my field.
Okay. So, now, I've been concerned with the gray hair, which is growing rapidly on my hair and other body parts. I don't know how old you are anyway. What is the cause of gray hair in a young adult, and how can it be managed or prevented?
Well, it's just the pigmentation of the hair fiber. I mean, you could have gray hair from after puberty. We still don't know why some people develop gray hair, earlier than you would expect. People normally associate gray hair with old age. No, I mean, I've seen loads of mid-20s or early 20s with gray hair or shock of gray hair. It's simply the pigmentation of the hair fiber. It's not hair loss. Like I said, we still don't know why, and a simple hair dye, which is very safe and simple to use, might be what you need. Nothing to worry about.
Okay. And then I've also noticed that some children are even born with a shock of gray hair in one corner of their head. So it's just, yes, I've seen a baby with a shock of gray hair right at the corner of the child's scalp. So maybe hereditary as well. I can't say, you're the expert.
I've never heard that one before. But then, you never know.
You never know. Okay, so now someone is asking, where do we see the consultants and the states where they can be seen? I need to meet the consultant and, if possible, get the phone number. So please, could you just quickly tell our audience the address of your clinic and where?
We've got 3 clinics in Africa at the moment. We've got one in Lagos, another one in Abuja, and then in Accra. The one in Lagos is in Falomo Ikoyi, and the one in Abuja is in Wuse 2 in Abuja, and then the one in Accra is in Chiashi, East Legon. Now, in terms of telephone number, let me just get contact details for you. So you could reach us on WhatsApp number, which is 0817 834 7454. That's Nigerian number. Or 0907 168 1615. So, I mean, and then in Abuja, you could reach us on 0817 347 7987. So those are all the different WhatsApp numbers that you could reach us on, and the client coordinators will be able to arrange a free consultation with one of our consultants.
Okay. Again, I'm repeating it for our audience: free consultation. Free consultation, and after that, you get to know what the cost implications of your treatment will be.
Precisely.
So that needs to be emphasized as well. Okay, now, being a mother myself, I've had a baby who came practically bald, and it was kind of embarrassing. And being in a part of Nigeria that was almost always hot all year round, having to band her hair was not an option. So the mother is asking here, my daughter's hair does not want to grow. She says, so what can be done? Because before you speak, I usually tell moms that the African baby that is born bald usually shocks everyone by age 5 to 7 with a full head they eventually have. That has been my experience. But the ones that come with a full head of hair may eventually not have so much hair when they grow up. So, dear mom, I'd like to tell you from a mother's perspective, just calm down. Don't let pressure of seeing babies with full buns get to you. Your baby's hair will eventually grow, especially if you have a lot of hair and her dad has a lot of hair. The hair will eventually grow. Bald babies always shock the nerves out of us eventually.
I can't provide a better answer. I can't provide a better answer than what you've given. I mean, you're absolutely spot on. But let me actually just go on one step further. The normal hair growth, the stage that we call the anagen stage of hair growth, can last anything from a few weeks to about 6 years. So it's a long process. So when a child you really nail, you really hit the nail on the head. You need to give time because the hair growth can happen anytime from birth right up to 6 years. So yeah, you're absolutely right. I can't answer that any more than what you've answered. Yeah.
All right. Thank you. Okay, so mom, I would like to. Okay, it's even a nursing father. Oh, so touching. I was saying, mom, question was from a nursing father. That's the name on the attached to the question. So I'd also like to encourage you to not force that hair. I see a lot of mothers, because their babies are practically bald, they use these elastic bands to pull the hair into small knots. You may be damaging the hair follicles at the bottom of the hair strands, you see. So
There's
just
no
leave
need.
the hair be. Just
Just leave it. Yeah.
small band on her hair and
Yeah.
that she's.
And
I believe every baby is beautiful. They were born beautiful. It's our pressure we
absolutely.
transfer to the children. We want the baby to be the perfect baby in our minds. That's not the baby's
Yeah.
problem. I see a lot
Yeah.
of mothers bend the babies in between their legs, forcing the hairstyle on the baby. That's a
Yeah.
reflection of your insecurities.
Anxieties.
On
Yeah.
don't have any business with that particular hairstyle, and then you're
Yeah.
trying to force the baby to look a certain way to fit into
No,
your
no.
what a beautiful baby is. So your 8-month-old baby is just as good as she was made, and her beauty, as we say, was follow come. So she's fine just the way she is. So you can leave the hair be as it is. It will eventually grow, just as Mr. Ayo has said, from any time from when you were born to 6 years. And like I said, she will shock your pants off, just as we say, and then she'll have beautiful hair, like just the way
You said it. You said it like a real mother would say. It. Absolutely spot on. No, absolutely. Yeah.
Yes. So I'll just take one final question, and this has to do with our health insurance packages and hair loss. So one is asking if Avon HMO covers hair loss and treatment for hair loss. Generally, anything cosmetic in the world of insurance, it's not specific to Avon HMO, no. The world of insurance, bariatric surgery, trying to make your legs have a thigh gap. There's a specific name for it. It doesn't come to mind readily now. Anything that is mainly cosmetic is not covered by health insurance. It's an exclusion for most health insurance companies. So it's not specific to Avon HM alone. So that's just to answer that question quickly. Now, I've got brown hair and it looks kind of dusty, especially when it's full. Please, is there any way to make it look neater and a bit more glossy? Mr. Ayo, please take it.
Brown hair, I mean, it's very unusual for Nigerian. So what? Sorry, what exactly is the question? I mean, I didn't quite catch the question.
Saying I have brown hair and it looks kind of dusty, especially when it's dusty. Is there any way to make it look neater and a bit more glossy?
Oh wow! I mean, that's a styling issue. I mean, you have to look for the products out there to make your hair look the way you want it. I mean, that's not hair loss. It's just it's like asking me how you want to style your hair, whether you want to comb it this side or comb it that side, or no, it's just a styling issue. Yeah.
Okay. Temitope is asking finally. I want to ask if age affects the hair loss, because I observed that I usually have hair growth when I was much younger, but now it's been a stunted growth and I've just had to live with it.
Yeah, I presume the questioner is female.
Yes.
Yeah, I mean, one of the things about the genetic form of hair loss is, you would typically expect about 40% of women to experience this particular type of alopecia up until menopause. So the closer you get to menopause, the more likely you're going to experience this kind of hair loss. So that explains why in your younger years you had full hair and bouncy hair, and it's now thinning, or maybe you're going slightly balding in the middle or whatever. But there are things you could do, before you actually go bald, and that is some of the steps I mentioned earlier about coming to see us and for us to do some therapies, to help you regain the fullness of your hair.
All right, questions we can take for today, Mr. Ayo. It's been an absolute delight having you here. I've learned so many things, and I've learned a lot. I've learned about washing my hands after using any hair product so that I don't develop beards. And
absolutely.
That bearded women.
Thank you very much, Dr. Jiro. Thank you very much. It's been a pleasure joining you.
Yes,
it's been a pleasure joining you.
Because I know the anxiety that comes with losing one's hair or not having healthy hair or being the mother of a baby without hair just never goes away. And we can't talk about hair enough. So now, thank you very, very, very much.
Thank you.
Who joined us. It was a pleasure having you. Sorry we could not take all your questions because we are pressed for time, and I know Mr. Ayo has other engagements to be at, just as I do. So, and just as you do as well. So we'll see you again until we come your way next time. It's bye from Avon HMO.
Bye-bye. Thank you.
Bye.
Bye-bye. Bye.